Today's case is episcleritis, how to confirm the diagnosis. I think you might be able to have a guess from this thumbnail, but the picture on the left shows a patient who presented with a red, sore, sensitive to light eye. So this is a young man who has a history of ulcerative colitis. And what you're seeing in the anterior vitreous there is actually a Mittendorf's dot, and we're going to go into that in a bit more detail in future videos, so don't worry about that. But let's focus on what we're seeing for now. We're seeing some generalized hyperemia, and the history is really important because you might want to differentiate conjunctivitis from episcleritis. Here there's no history of watering, discharge. The patient does have a risk factor in that they have ulcerative colitis, and they've had multiple previous episodes of episcleritis. There are two major types of episcleritis, diffuse and nodular. Here we have this diffuse episcleral injection. It's certainly not as severe as some other cases, and we do actually have some other, maybe more significant cases coming in the next few weeks. We actually have a scleritis case coming up, I think, next month. Okay, so the way to differentiate is you instill phenylephrine. Now you can either use 2.5% or 10%. 10% is ideal, but it's not always readily available. And here we've instilled 2.5%, and you can see there's significant blanching, especially in that nasal area where we suspect this. This condition is generally self-limiting, and even if you gave no treatment whatsoever, it would get better. But you can give oral non-steroidal tablets, such as ibuprofen, and some people use flurbiprofen, and this has been shown to improve symptoms and hasten the resolution. We're doing here a dilated fundus examination. Note that phenylephrine has dilated the pupil, and everything looks healthy. Hope you found this case useful, and remember to ask about systemic disease associations.